want you to say 99 for me.
99. 99.
One more time.
99.
Great. Hi, Kelly.
Hi.
Dr. B, nice to meet you.
Nice to meet you.
In for a new patient exam, correct?
Yes.
Okay, so we'll just kind of run through everything head to toe, unless you're having some other concerns, get you in the system, and then we'll kind of make sure that you are good to just do a yearly examination every year, okay?
Sounds great.
Okay. I'm just going to make a couple of little notes in my little app here, asking you from head to toe about any current issues that you might be having, or just regular, everyday medical experiences that you have. That will just give me a good sense of how to proceed with the exam.
Okay.
So starting with the head, do you experience any headaches?
Yes.
Okay, can you describe them for me?
It's usually when I wake up in the morning.
Interesting, okay. And then, are these like throbbing headaches, sharp pains?
I would say a dull
ache.
Dull ache, yes.
And can you point to where they occur generally?
Here and then on the side.
But always on that left side?
Yes.
Okay. And then when does it go away?
Usually around lunchtime.
So it's all morning?
Yeah.
And does anything help, like drinking a cup of coffee or eating something?
Yeah, water helps.
Water.
Some breakfast helps, definitely.
Okay. But either way, it kind of like persists until noonish.
Yeah.
Okay. Okay, moving down to your eyes. Do you wear any corrective lenses or contacts?
Yes, I wear blue light glasses for work.
Okay, but nothing with a prescription?
No.
Okay. Do you find the blue light glasses are helpful for you?
Yeah.
Great. But you don't wear them any other time, just when you're like sitting at your screen?
Right.
Okay. Any changes to your vision? Any blurriness, double vision, sparklies in your eyes?
No.
Great. And nothing with those headaches? You don't get any like sensitivity to light?
No, not to light.
Okay. Say something else.
Sometimes with noise.
Okay, sound sensitivity.
Sound is a little bit triggering, but light seems to be fine.
Okay. Any changes to your smell or clogged nostrils, drippiness, anything like that?
There's like a little bit of nasal drip, but that's kind of been
just this time of year kind of thing?
Exactly.
Or, okay.
Yeah.
Yeah. I mean, it's cold out and we're all drippy a little. But no occlusion where they're like you can't breathe out of your nose?
No.
Okay. Moving down to your mouth, any changes to your taste?
No.
Great. And are you going to the dentist for your teeth checks?
Yes, twice a year.
Great. And everything's been fine there?
Yeah.
Perfect. Any swelling or lumps in the throat?
No.
Okay. And moving down to your chest, any difficulty breathing or feeling like you can't catch your breath?
I get some tightness when I'm kind of in a heightened situation, if I have a meeting at work.
So kind of like with stress and anxiety?
Yeah, exactly.
Okay. Do you take anything for stress and anxiety, or just
breathing,
deep
exercises?
breathing?
Yeah.
Okay. Is that effective for you?
For the most part.
Okay. Any heart racing with that anxiety? Any like feeling of fluttering?
Definitely.
Okay. How about pain in the neck, back, spine, anything?
I think because I work sitting down.
Like the tech neck kind
there
of thing?
There is definitely tightness there, yeah.
Okay, we'll check the back out. And moving into your stomach, are you on a special diet or do you eat kind of omnivore?
Just high protein, high fiber. Yeah.
Okay, great. That's good.
Yeah.
That's a good diet. But you're eating meat, you're eating vegetables.
Yes.
Okay. There's nothing that you can't have. You're not on like a
correct.
Okay.
Yep.
Elimination diet or anything like that.
No.
And any stomach distress?
Only when I'm in kind of those high stress scenarios.
Okay, so you get like a little queasy with the anxiety.
Exactly.
Okay, I get that too. I understand. Okay, and what about moving on to your muscles and your joints? Any joint pain, muscle aches, anything injury-wise that I should know about?
I get a little bit of tightness in my wrists think
Okay.
also due to working, but
Okay, tightness in the wrists. We'll check for like the carpal tunnel and stuff if you're really like at a desk for 8+ hours a day and you're just really tippy-tapping away.
Yeah, exactly.
Okay. But nothing in like the knees, the ankles?
No.
Okay, great. And any trouble with balance, steadiness? Do you use any aids for walking?
No.
Excellent. Okay. All right, you can set that aside. I'm going to sanitize my hands. We'll start the exam. I know that's a bit of a long assessment in the beginning there, but it really helps me get a sense of what's going on. You seem like an overall healthy person, but there are definitely some things we can check out. I'm going to move, same thing with the physical exam. I'm going to move head to toe, just make it easier for me on the systems. Is it okay if I place my hands on you during the exam?
Yeah.
Okay. If at any time you feel uncomfortable, please just stop me. I'm going to start with the head and the scalp, so checking the hair. And I'm also going to be feeling for anything that might be kind of tender, especially with those headaches, especially on that side. So I'd like you to just tell me if you feel anything uncomfortable, okay? So starting with the side that doesn't have issues. I come around. So you feel the pain pretty much here through here?
Yeah.
Okay. Is it painful to the touch at all?
No.
Okay. That's good. Just lean forward gently for me. I'm just going to take a look at the back. Okay, that's fine. You can relax. So I didn't see anything concerning. You didn't have any pain for that. So I think the headaches is more of a internal thing than an external factor. I'm going to press on some spots on the face. Tell me if you have any pain with that, tenderness.
There's a little tenderness there in the sinus.
Which side?
On the left side.
The left side here. Okay. Go ahead and gently open your mouth just a little bit. Keep the eyes closed. Okay. Relax. So, but it doesn't feel bad on this side at all.
No.
Okay. Feel for pulses. A little stronger on the left side, actually. Gonna come here. Okay. Face. very symmetrical. Hair distribution is even and good. Not having any hair loss or anything like that, are you?
No.
Okay, looks nice and healthy and thick. Okay. All right, I'll have you look at me, and I'm going to make a couple of faces. So I want you to take a big smile. Okay, and now I want you to frown. I'm really unhappy. I'm so sad. Okay, and lift your eyebrows up nice and high. Don't let me push them down. Okay, and close them nice and tight. The eyes nice and tight. Squeeze, squeeze, squeeze. There you go. Very good. Can you puff your cheeks out? Okay, relax. So that's good. No drooping or anything like that. I'll have you push your tongue into my hand over here. Yeah, nice, strong over here. Does that trigger any pain up there?
No.
Excellent. I want you to open and close the jaw. One more time. Okay, clench the teeth. And does that cause any pain?
A little bit.
On the left side?
Mm-hmm.
Okay. So there was just a little bit of crepitus on this left side.
Okay.
I'm feeling like for the masseter muscle, and feel how here it's kind of like loose and here it's like super tight.
Mm-hmm.
Okay. So that could be one of the reasons you're getting... I wonder if you're grinding your teeth at night.
It's possible.
On that side.
Yeah.
Do you sleep on this side?
I do.
So I'm not diagnosing you yet, but my theory, you're sleeping on this side, so your face is staying relatively stable.
Yeah.
And then on this side, you're like,
right.
And it's causing this like strain and pain that might come up into here. And then also, it could be swelling up and affecting the sinuses there as well. Again, let's do the full thing, but that's my initial thought process for that. All right, I'm going to feel your lymph nodes, so just relax. I'm going to have you swallow for me. Good. All right, now you get to take a little break from all the work. I'm going to look into your eyes. So just have you stare straight ahead right there and try to ignore the light. I know it's going to be a bit bright. Awesome. Very good. Feel free to blink and relax. Still ignoring the light. Nice. Coming from the side. And you've got really nice and light eyes, but that also, are you wearing sunglasses outside when it's sunny?
Yeah.
Good, because they can also definitely be affected by the brightness with they're so light. What color would you call these? They're like gray, your eyes, almost.
Yeah.
Gray, green, hazily.
Yeah.
Very pretty. All right, back to the work for you. See the little light on the tip of this pen?
Yes.
I want you to follow it with your head staying still and only your eyes moving. Is it double vision at all here, or is it clear?
Clear.
Good. Nice. Excellent. Okay, I want you to follow all the way in. Okay, and out. And now keep looking at this light. Ignore my finger. And now look at the finger. And back to the light. Make you go cross-eyed there. Alright, now just relax. You can open your eyes for one more second, sorry. Okay. tell me what color this is.
Yellow.
And this one.
Blue.
And can you read this right there? That little...
Cool colors.
Very good. And I'm going to have you read this word here too, upside down.
Red, orange.
Okay, and point to the purple. Any purple will do. Great. And point to a green. And point to a red. Excellent. Okay, I've got a little piece of cotton. And test the eye reflex. So again, look straight ahead. And just relax. There we go. There we go. Perfect. All right, while I have this out, close the eyes. Tell me you can feel that.
Yes. 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 Yes.
Okay, does it feel the same here and here?
Yes.
Same.
Yes. Yes.
Okay. And we'll see if you can feel the difference between this sharp sensation. I'll show you on your chest. That's sharp. This is dull. Okay?
Okay. Sharp. Dull. Dull. Sharp. Sharp.
Okay, moving down.
Sharp. Dull. Dull. Sharp.
Okay, that's all fine. No issues with like tingling of the fingers or anything like that?
No.
We'll test some things when we move down there, but let's finish up with up here first. So eyes look pretty good. I'll have you just cover one eye here. I'll have you cover it with this. And look straight at me if you don't mind. You see my nose here? Point right at my nose. Okay, just tell me when you see my fingers wiggling, don't move away from my nose.
Yes.
Good.
Yes.
Good.
Yes.
Okay, keep that eye covered. I'm going to just switch over here.
Yes. Yes. Yes.
Okay, and now you can switch eyes.
Yes. 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 Yes.
Mm-hmm.
Yes.
Normal peripheral vision. Move to your nose. We'll have you tilt back just a little bit. You said you had a couple of drippies. So the left side's pretty occluded actually. Okay. And give you something to smell, so close your eyes. And then can you close one of your nares there? Yeah. Whichever first. Let's see if I can get this open. There we go. I'm going to take a nice deep breath in. What does that smell like?
Lavender.
That's exactly right. And let's do the other side now. And over here.
Rubbing alcohol.
Yeah, that's exactly right. Okay. And we won't waste this. All right, now moving on to your mouth. You said you don't have any changes to your taste. Everything tastes salty sweet as it should.
Right.
Okay, just open up and say, ah. Okay. And lift the tongue down. Okay, very good. Just gonna open up, just gonna tap the teeth a little bit. Okay, that's fine. Okay, relax the jaw. And then right away, push against me with the jaw. There you go. Nice and strong. And I'll test a reflex there as well. So now I want you to let it go nice and loose. Okay, excellent. All right. So last thing up here is your hearing, and then I'm going to have you lay down so I can listen to your chest and stuff.
Okay.
So, any pain on the ears?
No.
Take a look inside. Beautiful. It's over here. Okay. I've got a little clicky sound, just like that. With your eyes closed, I want you to tell me left or right, or where you hear it, okay?
Right. Left. Right. Right. Left. Left. Right. 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 Left. Left.
Okay. And now, I'm going to hit this and put it on the top of your head and tell me which side you hear it more on or if it's equal on both.
Okay. Right.
Okay.
Both.
Feel both equally. Excellent. Now have you lean forward just a touch. I'm going to put this behind here. Do you feel that? Hear that?
Yes.
Okay. Is it louder here?
Yes.
Hear that?
Yep.
Which one's louder, this one or this one?
The first one.
First one. And do you feel the vibration there?
Yes.
Does it feel just as strong there?
Yes.
Okay. All right. So I'll have you kind of scooch down so I can listen to your chest, your lungs. Just relax back. So they took your vitals already, the nurse took your vitals, and everything was normal.
Okay.
But I want to listen to the chest, so just relax. I'm going to listen to the heart first.
Okay.
It's on this side, and you don't have to change your breathing style at all. Just gonna come over here. Okay, now I want you to take a deep breath. And out. One more. Okay, just relax. I'm going to listen. And breathe normally. I want you to say 99 for me.
99. 99.
One more time.
99.
Great. Do a little tapping. Okay. I'm going to move down to the stomach first, taking a listen. And you are on a high protein diet.
Mm-hmm.
And that's working for you. You're not having stomach aches or...
No.
Okay, great. Sounds nice and gurgly, just how we like it. Okay, I'm going to feel a little bit here. If there's any pain, please let me know. Go a little deeper. I'm going to slip my hand under here. I'm going to be feeling for the kidneys. And they're not palpable, which is awesome. You ready to do some strength?
Yeah.
Okay. Arms, this arm up, push against me. And now up like this, push against me. Pull me towards you, like that. Yeah, nice. Hands up, push down. And then push back against me, just with the hands, so relax the arm. And push back. There we go, excellent. Spread your fingers out nice and wide. Cool, same thing on this side. Up, push me into the table. Arm up like this, push me away. Pull me towards you, wrist down, and down, push against me, very good. Fingers out nice and wide. Okay, and I'm gonna have you kind of go up as far as you can go, and down as far as you can go. Any pain in the shoulders with that?
No, just a little tightness.
Okay, I'm gonna palpate all the joints, just relax, and you can tuck your shirt down if you'd like. It's very tight there. What's your exercise routines look like?
2 to 3 times a week. I'll do kind of light lifting.
Mm-hmm. Excellent. Okay, just relax. I'm going to make the movements now. Looking for tone. You're nice and strong, so that's excellent. Tone is good. Okay, while I have you laying down, I'm going to move to your legs. Then I'm going to sit you up. We'll do a couple more things with the upper body. Moving on down to your legs, we'll start with the same strength again. So push up against me. Okay, a little weakness there. Push up against me. So we need to add a leg day.
Yeah.
Up like this. Push out. Pull in. Yeah, that's nice and strong. So same thing here. Out. Push out. Very good. Feet up against me. So back. Yep. Push down on the gas. Back here. Down on the gas. Okay, can you turn your ankles inwards and outwards? Okay. See if I can get your reflexes while you're laying down. So give me all your weight. Yeah, there you go. Just a little bit. Might do that while you're sitting up. Oh, there you go. That side of it. Okay, we got it. Pull it back here. It's gonna feel kind of funny. Scrape. Okay. And you're not ticklish at the bottom of your feet, are you?
No.
Okay, so that's fine. Not getting a reaction. I'm gonna check for clonus. And then you can just relax. Do you feel that vibration?
Yeah.
Tell me when it goes away. Feel that there?
Yeah.
Tell me when it goes away.
Gone.
Very good. And last thing I do down here is check the pulses. Feet are a little cold. Is that typical for you?
Yeah.
Okay.
Circulation is
Hmm?
tough down there.
Yep, that's fair. Just feeling the muscle tone. All right. So I'll have you sit up that way and swing your legs like that. Very good. And I want to check the back. So sanitize again since we wrap the feet. So I'd like you to bend forward like you're gonna touch your toes with your head. Yep, exactly, nice and round. And I'd like you to come up slow, one vertebrae at a time. Okay, spine feels straight to me. You've never been told you had scoliosis or anything, have you?
No.
Okay, yep, feels good. You do have a little bit of that lean forward, which is very common.
Mm-hmm.
Feeling these back muscles. I'm going to turn you. Any pain with that?
No.
Okay. Can you tilt down this way and now the other way? Good, good range of motion. Tip your head back against me. Okay. And turn this way. Turn this way. Yeah. I'm going to repeat the same thing I did with your lungs on the front, and I'm going to have you take 4 deep breaths. Every time you touch me, take a deep breath. Good, all clear. So you feel the tapping again. So I want you to take a nice deep breath in and hold it. Okay, let it out all the way and don't take another in. Okay, you're fine. Relax, breathe normally. And last time, 1 deep breath in and out. Okay, good expansion. Any pain there?
No.
That's all good. Do you feel that all the way down the spine?
Yeah.
All the same?
Yeah.
There's only one last thing I want to do going back here is just take a better look at the scalp because it's a little hard to see while you were sitting up. So checking the skin. You're a little freckly, so we want to make sure you're wearing your sunscreen. Okay. Last thing, swing back towards me. Okay. And we'll just check the skin on the front. Oh, I actually wanted to look at your wrists as well because you said you were having some wrist pain, right?
Yeah.
Can you do a full rotation for me? Pain with that?
A little tightness.
Tightness? Okay, go like this, squeeze nice and tight. Does that cause that tightness here?
It's not as bad.
Okay, and now go down like this. Does that cause any pain or tingling?
A little bit more.
Okay, up, relax. I'm gonna stretch the forearm. Does that feel good or bad?
Good.
Okay.
Good.
Good, okay. Yeah, so I think definitely need to be stretching out the forearms more often. I think with your computer use, there's a chance that you're going to develop carpal tunnel later in life, especially because with that one test you had some discomfort. So that's a good indication that that nerve right there is getting pinched a little bit. And unfortunately with carpal tunnel, when it's really bad, your option is pretty much surgery to repair. So we'll send you home with some exercises to do to strengthen and stretch out the wrists, especially if you're lifting a few days a week. Making sure those wrists are really strong and in the right position when you're holding the weights is going to be vital for you. But you're doing the right things and you seem healthy overall. I'm also going to get you a mouth guard. We're going to see if that helps with the headaches in the morning and the jaw pain, the jaw tightness on this side. If it doesn't, we'll send you to the migraine clinic and get a full workup, okay?
Perfect.
Any questions for me today, Kelly?
No, thank you so much.
Thank you. It was great to have you in. And I would say, with these improvements, we'll check in just via the phone in like 2 months.
Okay.
And then I think we can just schedule you for a year out.
Perfect.
Thanks.
Thank you.